transform primary health care systems in ways that respond to patients' reporting of their experiences of the quality of care, including people who face multiple disadvantages in accessing and using the healthcare system, such as those who have language barriers or live in poverty. So I'll turn it over to you, Sabrina, when you're ready.
Great. Oops.
Good.
Okay, let's go. Bonsoir, je suis né à Edmonton, en Alberta, au Canada. Mon père est francophone et chinois. Les francophones ne sont pas entendus dans cette partie du Canada. And we'll just wait for the slide to turn over. 我们的世界是和商贸虽然不是他人学习，谁会想到世界马来上的记录可以在其实实施设定。ما باید با کسانی که معمولاً صداشون رو نمیشنوم گوش بدم. Whew, I'm glad those are over. 3 different languages. I hope you understood which ones they were. The first 3 slides have tried to highlight that there are voices of patients that are not heard. I'm going to provide some examples now about how we're trying to engage patients in our work. So the first one is the British Columbia Primary Healthcare Research Network, and we've developed a patient advisory to provide input on BC primary healthcare. Patients across BC provided their input on research priorities for the BC PHCRN. Then they released a province-wide survey to patients where they ranked their priorities in terms of importance. 464 patients participated in this work. You can see in this slide that there are some top priorities that are listed here, and you probably can't see them, but they range from the research on integration of mental health research resources to examining new models of care. And so now we've almost finished this work. We had a meeting in September of 2018 where we held a dialogue event between patients and other stakeholder groups. And you can see here that there was a convergence between the top research priorities among the patients and the decision makers. There were a total of 22 people who attended from the BC PHCRN advisory, patient advisory, leads, and staff. The BC PHCRN is part of a network of networks to form the Strategy for Patient-Oriented Research Primary and Integrated Healthcare Innovation Network. Patients have been involved in all aspects of the research, from governance, setting priorities, involvement in projects, and interpretation of results. The second example is that patients engage in research by allowing their data to be submitted through the Canadian Primary Care Sentinel Surveillance Network. And to date, there's almost 2 million patients who have submitted their data to produce new knowledge in the area of primary care. Some of these data include patient sociodemographics, laboratory data, disease and health conditions, medications, examinations, referral, and procedure data. So there's quite a lot of data that they have allowed to be submitted through this network. And so if we have all these patient data, then we can move from individuals to groups. We can do things like chronic disease surveillance, so things like looking at obesity rates and antimicrobial resistance, and we can do research, so looking at things like how low blood pressure is associated with the increased risk of getting dementia. Patients in interior health are contributing to a pilot project, and we're looking to see what their journey looks like across the system, across the geography of interior health. And so SIPSIN is a technology that's being used here, but this has the attention of the Ministry of Health. Patients are also helping clinicians make sense of their data and provide better quality of care. And this is a picture showing you an example of the quality improvement tool within the SIPSIN that allows the patient data to be fed back to clinicians, both for practice improvement and also for the patients themselves. There are different individual pieces, and sometimes they're hard to see. It's hard to see the bigger picture. And there's another example here of a study where we include patient voices that are in surveys, deliberative dialogues, and interviews. And we're trying to improve the science and reporting of performance in primary care. Patients are informing whether there is transformation in primary care towards a patient medical home, and their voices are an important part of this picture. And we are trying to ensure that their voices are being included as we move forward in this endeavor. We'll just keep on waiting. Over 3,000 patients have participated in our study to date, and they're telling us about their experiences in primary care in answering questions here.